At the end of the day, people are carrying out jobs which are high risk. Getting in there to do a job as quickly as you can, spend the least amount of money as you can and charge the most that you possibly can and forget the people in between.
The scaffolding, roofing, done wrong, it can be high risk.
It's the other side of health and safety. They can see quite clearly from the appointments that they're having with me how their blood pressure is comparing. The ones that I most commonly find, I suppose, would be cocaine and cannabis. If I can help at least one person, then I've done my job. By having a service like this in the workplace, it just allows people to not have to take time off work, lose out on pay. They can access information about their health and well-being, in a 30-minute appointment and then go straight back to work.
We often feel a twinge or we feel like something not quite right and we kick it down the road.
If you feel something's not right to your body, listen to your body.
Hi guys, welcome to Embassy Site Services Spotlight Sessions, and we're here today with Charlie from Rapid Health, who've been working alongside Embassy Site Services to support their workers. Charlie, thanks for joining us.
Thank you. It's nice to talk about the subject because not many people know what occupational health is and how it can benefit people. So yeah, I'm happy to give my my little insight into it and hopefully help people understand it a little bit better. Yeah.
Well, let's start by actually explaining what occupational health means, because I think it's something that lots of people have heard of, but not necessarily know what it entails.
Yeah, so occupational health in a nutshell, I suppose, is supporting people with their health and well-being and ensuring that people are carrying out their job in a safe way, supporting health and safety to ensure that people go home safe to their families. They live, long lives free from poor health caused by the job that they're doing. So my role is very much there to help people with their health and well-being, educate people on ways to do things slightly better, to help you, to save you from developing poor health going forwards. So Billy, with the health assessment I'm going to do today, I'm going to provide you with information about your blood pressure, cholesterol, diabetes risk. I can also tell you how much body fat you've got, how much muscle mass you've got.
I don't want to know that. So with regards to occupational health, is it just physical health or is it mental health as well?
So both. Mental health is just as important as physical health. There is a big emphasis on looking after people's physical side of what they're doing in the workplace, making sure people are carrying out jobs not to affect their lungs, for example, or their hearing or their eyesight. But mental health side of things is often not thought about as much as the physical side. So there seems to be more awareness on that matter now, and that's something that I'm helping to drive forward within the construction industry. Mental health is not something that is often spoke about, or it hasn't been in the past. There seems to be more conversations around that subject now, but yeah, definitely it kind of encompasses both physical and mental. Yeah.
So Charlie, we just sort of talked about this off air a little bit. Like, there is a stigma around men and men accessing health and especially mental health.
Yeah.
How do you overcome those issues within the construction industry? Because obviously it's an industry that is heavily men dominant, shall we say.
Yeah.
Do you find that's something where people are reluctant, or is it getting better?
So there is a reluctancy around accessing medical support for men in general. I think the thing that separates me and what I do aside from other companies is the fact that I like to think that I'm quite an approachable person, and relatable as well. So there definitely is a stigma around men accessing medical support, because generally the feeling is that we're meant to be providers, supporters of our families, and quite often the health side of people gets pushed to one side. So by me working on projects, offering health MOTs where I can check people's cholesterol, blood pressure, other checks as well, such as muscle mass, bone density, all these types of things, I can help people improve their health and well-being in a friendly, approachable manner.
And their relationships must be really important then, right?
Definitely, yeah. So, when I attend sites, it's not really like a patient, doctor kind of feel. It's more of an approachable service where people come along and, they see me as being not only someone there to offer health MOTs and checks, but I'm also like a friendly face as well. And there's been times where I've attended projects as well, and then people have come up to me and said, "Oh, well, I remember you from working on such and such," and that's always really good to hear. There was one instance where I was meeting a new client actually that was interested in developing an occupational health service for their business, and there was, while I was having a tour of the site, there was a person that came up to me in front of the prospective client and said, "Oh, Charlie, I remember you from working on a particular site," and he said, "I'm so pleased that I saw you, because that helped me gain some access to my GP with regards to my blood pressure. You told me at the time that my blood pressure was elevated. Since then I've seen my GP, they've put me on medication that's brought my blood pressure down, and potentially you saved my life," which is really satisfying for me to hear.
Yeah, I mean, that's an incredible success story, right? And
Yeah.
I mean, when obviously people are hearing things like that must encourage others to then come and see you, yeah?
Definitely, yeah. Word spreads, and I think initially, whenever I'm on sites offering, various different health assessments, there is a reluctancy there. There is the whole element of it as well, where sometimes my visit is mandatory. There are health assessments that do need to be carried out in order to make sure that people, are fit for the job that they're doing. So, for example, if someone's working at heights, if they're a roofer, for example, like with Embassy, it's important to make sure that there's any medication that someone's taken, it's not going to impair their judgment. What's their grip strength like? Because at the end of the day, people are carrying out jobs which are high risk, and my role is to ensure that that it's safe for them to do so. If somebody in the unlikely event fails one of the assessments, then it's not just a case of you can't work here, you're not fit for the role. It's then about working with health and safety, working with the organisation to see what systems that we can put in place to help someone do their job in a safe way. Might be a buddy system. They might have to work alongside another member of staff. There's various different methods that we can do, but that normally comes in the form of a risk assessment that the company would do on the back of the health assessments that I do.
So how do you find that companies tend to approach you? Is it that they wait for an issue to arise, or is it that you approach them and you say, "Look, before this issue arises, I can give you solutions to look after your workforce and maintain your workforce"?
Generally, the customers that I work with up to now approach me, and it's the same with Embassy. It's that they're a modern organisation that take the health and well-being of their workers into the utmost importance, and that is something which is obviously spurred on Embassy to have discussions with me and talk about what I do and how I can help them with their teams on site. But yeah, generally I'm not really looking to approach companies. Companies tend to come to me. I mean, I've worked on some quite large projects, so there is an element of me having a bit of a name for myself within the industry. But yeah, that's the kind of way. Yeah.
And I know that, obviously Dan and Matt and I have spoken a lot about this, about the importance of, Embassy. It's like a family, and they do treat their employees like, family, and they want them to do well. They want them to succeed. They want to give them routes to progress, not just in the industry itself, but in their everyday lives. And you would be someone who'd be able to help them do that, right?
It's so refreshing to work with companies who actively take an interest in the health and well-being of their workforce. You've got the old school organisations that, it's just money driven. Getting in there to do a job as quickly as you can, spend the least amount of money as you can, and charge the most that you possibly can, and forget the people in between that, potentially are doing high risk jobs, and it's just nice to be affiliated with an organisation like Embassy who take their health and well-being of their workforce seriously. It's nice.
And going back to what you said about high risk jobs, obviously scaffolding, roofing, done wrong, it can be high risk, absolutely.
You've got about 8 kg extra muscle, more than what the minimum should be for someone of your weight.
Right.
Bone density.
Is that all right? Is that...
That's really good. Right. Yeah. So Rapid Health and Wellbeing isn't just a singular person. It's not just me working with an organisation. So it's a network. So I work with a team of nurses, doctors, specialists. So if somebody comes to see me and they've got a particular health problem, I'm not necessarily going to know the answer to every single question that people have. But the good thing about working with my organisation is the fact that you have access to all of these other specialists as well that can quite often give you the answer that you're looking for and point you in the direction of where you need to turn.
So one of the things in the industry that has been mentioned previously is things like drug and alcohol dependency. How would your company, how would Rapid Health deal with something like that, a dependency issue?
So sensitively, but safely. Yeah. So ensuring that somebody has access to the relevant help services that can help support them going forwards. But ultimately, there is the side of things where if you are doing a particularly dangerous job, being under the influence of a particular substance is not going to be a good mix. So the safety side of things that we have in place is regular drug and alcohol testing. There's a full list of different drug types that we tend to test for. The ones that I most commonly find, I suppose, would be cocaine and cannabis in terms of the illegal substances side. There is the element that some people take prescription medication as well, which obviously, needs to be handled as well.
Do you know, there's that really funny story. Well, I suppose it's not funny for the person involved, and it's a bit of a sort of urban myth, but there was a guy who was, he was a forklift truck driver or something like that, and he was done for, he failed a drugs test for opiates. And he'd never taken drugs in his life, didn't drink or anything like that.
Poppy seeds.
And it was poppy seeds in the bread. Yeah. And his wife used to make him poppy seed bread sandwiches every day, and it was poppy seeds. And
so normally when that happens, someone wouldn't necessarily foul if they'd
have traces, or
they would have traces. So poppy seeds give you elevated levels of opiates within your urine, if that's what's being tested, which also is connected to heroin. It's within the same family as drugs as heroin. So what would normally happen if somebody fails on opiates, whether it be poppy seeds that have triggered it, is somebody would most likely be suspended from doing safety critical works. So you wouldn't necessarily be able to drive a crane or work up high, but they would be given other work to do pending the results of the back from the lab. If their lab results are consistent with having a sandwich, poppy seeds, then obviously back to work, no problem. But if they're consistent with a more serious substance, higher levels within the system, then they'll be treated in a different manner.
And have you got any specific examples? Obviously, you don't give us names or anything, but like of people that you've worked with that you feel, and obviously you mentioned about the high blood pressure, but is there any other examples that you've worked with someone where you've turned their life around?
Definitely. So as part of what I do, we offer health checks as well as the safety health assessments. And on the health checks that we do, we provide a record at the end of the appointment, which has different bar charts and graphs showing people how their numbers compare from one appointment to the next. I've got a number of customers that work with me. And they come along for repeat visits, and they can see quite clearly from the appointments that they're having with me how their blood pressure is comparing. From the first appointment, it might be very high, it might be in the red, but then just by coming to see me on a regular basis, by me giving them information about stress management, getting enough sleep, drinking enough water, doing more exercise, all these different things that can have an effect on your blood pressure, for example, they can see over time how their blood pressure becomes better when they're addressing these things that I'm kind of giving them information about.
Yeah, and that's fantastic because, as you say, blood pressure, they call it the silent killer, don't they? Because ultimately it's something that affects lots of people in lots of different ways. How do you get over, obviously, we mentioned about, construction sites, there's lots of lads working on the construction sites. There's lots of boys being boys, shall we say. If you go in to do a training course on, say, safe lifting or movement or anything like that, how do you get past that element of them not taking it seriously or taking the mickey or like having a bit of banter and things?
Fair. So whenever I'm delivering training, again, it's delivered in such a way which is relatable. Yeah. So because I'm there training, I'm delivering the session. It doesn't make me any less important on doing these activities that I'm talking about than the people that I'm telling them to. So quite often I put myself, with the people that I'm training. So I say, when we're doing these different types of activities, even me, for example, we're all at risk of developing these types of conditions going forwards, ergonomics, musculoskeletal problems going forward. So just by doing it in this way, hopefully will help you from suffering in the long term with your health and well-being.
What would your daily sort of routine look like, say, on site? So you're going on site for a visit. What does it entail?
So generally when I attend site, it depends on the nature of the visit while I'm there, but I can deliver a toolbox talk, and quite often, there might be 200 people, for example, in attendance, and again, some people say to me, but isn't that scary, isn't it intimidating, 200 construction workers, but I don't think so, because the people that are there, there might be, a handful of people that are thinking, this doesn't really appeal to me. But then, as I've always said, if I can help at least one person when I attend site better their health and save them from developing a more serious condition going forwards, then I've done my job. But it's obviously when I'm attending site and it's I'm there to deliver safety critical medicals, then it's a different kettle of fish. Obviously it's an appointment system, people come along for the assessments, but again it's always delivered in such a way where people leave the appointments feeling like they've got more information than what they went in there with in order to help them with their health.
So you'd rather speak to 200 people than 4 cameras, right?
Definitely. Yeah. So I find, speaking to construction workers, in general, not a scary thing because, it's people like me, I guess, and that's why I like it so much. I mean, I must admit, I'm not someone that enjoys, the corporate side of things, but just it takes me back, as I say, to when I first got into, the occupational health industry. I'm someone that enjoys to help people and support them with their health and well-being. If I can work with people that, are just like normal everyday people, then I'm happy to do that. Yep. Nice one just on the side, sorry about that, it's like a little bee sting, and then just a little bit on here.
No one wants to take time off work ultimately, so would you advise people that if they are feeling like a twinge in their back or if their mental health isn't quite right, to get support earlier rather than later?
Definitely. Yeah. It goes without saying that early intervention is key to helping you, prevent your symptoms from worsening. So definitely, if you've got any signs and symptoms that something's not right, listening to your body is so important.
And how would someone like yourself work with the wider embassy community? Like, so Seb is obviously, our health and safety officer and things. How would someone like yourself work alongside him?
So my role is to assist Seb with regards to, obviously it's health and safety. So you've got the safety element of it, and then you've got the health side of things, which is really where I can step in and I can offer, a lot of expertise. So by offering safety critical medicals, for example, where we check people's hearing, their vision, blood pressure, there's various different checks that we can do. It just helps Embassy, for example, ensure that their workers are working safely.
So it's a complement alongside what's already in place, yeah?
It's the other side of health and safety, and it's really refreshing to see a company like Embassy taking that side of things very seriously, because quite often the health side of things gets pushed to one side, and it's all about safety, whereas the health element of how people are working is really important too.
And not just the health and safety, but also sometimes it's just about the job, getting the job done. And actually, Embassy's not like that. They're not the sort of company that do those things. Their workers mean more to them than that, right?
Definitely, yeah, and that's what I think makes Embassy different from the rest. They do take a proactive approach with regards to health and well-being and safety standards of the roofers in particular. But yeah, it's really good to see the health and safety side of Embassy working in such a proactive way. One of the other things as well that I wanted to speak about is the fact that NHS in general at the moment, the waiting times to go and see your GP.
It's crazy, right?
They're so long, so even if you want to book an appointment, you might have to wait months and months in order to go and see your GP. And there's also the element of things where if people have an issue with their, they've got a concern with their health, they're worried about taking time off to go and see their GP, because quite often people are on a day rate. And it affects their pay and their ability to pay their mortgages, support their families. So by having a service like this in the workplace, by bringing the practice back to the workplace, it just allows people to not have to take time off work, lose out on pay. They can access information about their health and well-being, in a 30-minute appointment, and then go straight back to work.
So Charlie, going back to Rapid Health, are there certain aspects of occupational health that are more prevalent in the construction industry that Rapid Health offers?
So safety critical medicals being the first and foremost, making sure that people are carrying out their jobs in a safe way. There's not any underlying conditions that people might have, which might stop them from working in a safe manner. There's also health checks, what we call health MOTs, where we can check people's cholesterol, diabetes risk, blood pressure, muscle mass, body fat, bone density, hydration. The list goes on. And then also on top of that, we offer health promotion as well. So campaigns based on the national campaigns that are running. So there might be more of an importance in the winter time to talk about ways to protect yourself from developing a cold and the flu, for example. In the summertime, it's all about educating people on ways to protect your skin, making sure that you're wearing some protection factors, and stuff like that. So yeah. Safety critical medicals, health checks, campaigns, and then also drug and alcohol testing as well. These are all the types of services that we're currently offering, and we're working with Embassy to deliver at the moment. So yeah.
And it sounds like a lot of that's around education more than anything else. Educating people on actually things that they might not be aware of.
Definitely. So as we spoke earlier on, prevention is the best form of protecting yourself from developing anything long term. So by getting in there nice and early, educating people on how they can look after themselves with regards to their health and well-being, that's the most important thing that we can do, I think.
And what are some of the services that you offer that are maybe a bit lesser well known, that someone might be struggling with something, they just don't know how to access the help for it? Is there anything like that that's kind of we're not aware of?
So I guess maybe mental health is something where people might not necessarily be as forthcoming to have assessed as other elements of their physical well-being. But yeah, definitely, by coming to see myself or one of one of my team that work for Rapid Health and Wellbeing, you've got the access to be able to talk about your mental health in general, and hopefully get some support with how you can make that better, and signposting as well. It's important, goes without saying, the more weight we carry on our shoulders over a long period of time obviously can have an effect on our overall health and well-being. So, by coming along to services like this, we can have discussions with you to support that as well.
Charlie, let's say that someone was worried about a colleague of theirs. Maybe they've noticed their behaviour's changed, or they've noticed that they are in pain potentially on a job. Is there a way that people can support their colleagues by reporting anonymously or referring them?
Yeah, so we have a QR code system in place that allows people to do exactly that.
Perfect. That's great. That's really, really good. And it's good that, again, we talk about technology and about how Embassy is innovative, and that's one way of doing it, right?
Yeah, definitely. I mean, at the end of the day, technology is the way forward, and by us being able to use systems such as QR codes to be able to, signpost people to different health information, and also allow people to, feed things back to us. It's very important to be open to different technologies as well.
Brilliant. Charlie, thank you ever so much for your time. We really, really appreciate it.
Thank you.